So these are the recently healed scars. The patient underwent surgery around 4 weeks ago. So I'll show you the difference between an adhered scar and the one which is not adhered. So this scar, I'm able to pick it up, I'm able to move it. See the amount of mobility here. But this one, see, I'm not able to pick up the scar, and that shows that it is adhered. The scar actually sinks in. Okay, so now I'll show you the ways to mobilize. But before that, let us know when to mobilize. When there is no active bleeding, when you can see this scar formation, or what we commonly say as khapli, and there is no active bleeding, is a green flag for this. So basically there are very easy steps to mobilize your scar, which are firstly around the scar. We do kneading around the scar, very mild, using your finger pad. So you just kind of go in circular motions with mild pressure around the scar to kind of avoid formation of new adherence. And see, this is how it's done. You'll feel something solid kind of thing below your hand, and after those, that are the adherent points. So when they kind of release, you feel a soft texture. See, now my finger kind of sinks in, but where there are adherent points, see here, it's difficult for me to push inside. Okay, second thing is above the scar. So with the finger pad, I'll just place my finger on the scar, and in circular motions with very mild pressure, I'll go like this on the scar itself. Okay, so this is how it's done. Now next, what we do is we kind of move the whole scar. What we do is hold on both sides and push in two different directions. Okay, so this is how we do it. Second is same finger placement, and we kind of pull the scar away. Okay, with very mild pressure. You might not want to kind of open up the scar, so very mild pressure. You can see how I'm doing here. Okay, so next is horizontally, you kind of pull away the scar. Okay, like this. Now you might want to pick up the scar and check. See, this is how. And then when you pick up the scar, you also kind of move it in all directions to check if it is still adhered. And you might also want to check for how much area it has adhered to, or how deep is the adherence of the wound. So this is how you do it. So now this is a completely non-adherent scar. You can see how flexible it is. It moves in all directions. Okay, so this is the final result that you are hoping for.